Now, have you seen the effects of how the lack of representation in the optometry field affects our society? Because I know there are different diseases and everything that hone in on our community. Things that come to mind for me are just like, cataracts and glaucoma.
Right.
I can swear that every old Black person has always talked about their glaucoma.
You're right.
Can you speak on how those diseases affect us and then how more representation within the field can help us?
Yeah, definitely. So African Americans have some of the highest rates of vision impairment and blindness due to eye disease. And unfortunately, not too many African Americans get their regular, comprehensive, dilated eye exams. The dilated portion is what's most important. Some people just like to go to the eye doctor and just check to see if they can see the 20/20 line. But eye care is so much more than just seeing the 20/20 line. It's really important to get those drops. People are like, oh, you're putting these drops in my eyes. Yes, it's really important to do the dilated portion of your eye exam because it can help save your sight. So so we can check your eyes to make sure that there's nothing going on. So the main diseases that we hear about throughout our life that affect our people, such as high blood pressure, diabetes, high cholesterol, or any type of heart disease, affect the eye as well. And most people don't know this, but the eye is one of the first places that signs of high blood pressure or diabetes is found. And the way that we're able to see that is from putting those dilating drops into your eyes. We open up your pupil, we shine some lights back there, and we're checking to see how your blood vessels are reacting to things. We're checking to see if your blood vessels are tortuous or if there's bleeding in your blood vessels in the back of your eye. And if we see that there's bleeding in the back of your eye, that tells us that there's bleeding everywhere in your body and that something needs to be checked out. So glaucoma, like you stated, is another vision-threatening disease that affects African Americans at a higher rate and at a much younger age than other ethnicities. So this is why, for one, representation is important because we need to be educating our people about these eye diseases and how it can cause blindness, and most of the time preventable blindness. And honestly, it's a lot easier to hear it coming from someone who looks like you and believing them than someone who doesn't look like you. Because, like, for instance, my grandma, she just thinks that everyone's trying to get over on her. But no, grandma, like, you really have this problem. Listen to me. So if she saw someone who looked like her in that field, she may actually take that information and the knowledge that the doctor was giving and apply it and actually listen to the instructions to help save her sight.
And that is really true because I know that I really wish I could have Black doctors all the way around from head to the toe.
Yes.
I am terrible. I haven't been to the eye doctor in a long time. My first and only eye prescription was when I was a junior in high school. And
wow.
I'm out of college now.
It's time. It's
time. And I know that if someone would, like, just hearing you say this right now, it's making me think, okay, I need to go set an appointment right now. So that way I can get my eyes checked out. And I'm sure that a lot of our families would trust that information coming from someone who looked like them.
Exactly. I 100% agree.